I get asked a lot about what ICRW does, and because research is in the name of our institution, how can research make a difference? How does research help women and their families climb out of poverty? I could give the answer in words. It's a somewhat long answer. But to understand the impact of the research we do, I think it's more important to see what we do and to hear some of the stories of the impact we've had through our work.
Many of the issues that girls in developing countries face are different from the issues that girls in the U.S. face. Child marriage, for example, this is an epidemic in countries like India, Bangladesh, Mali, Senegal, where early marriage rates for girls are very, very high. And it is mostly girls who are getting married at ages 13, 14, 15, and sometimes even as young as 8 or 9. So in India, we work with a local organization in a state like Maharashtra, identify that a solution would be a life skills program that would train girls and their parents to really negotiate and understand that girls can do other things in their adolescence besides get married. We implement that program, we achieve success where marriage is delayed for those girls by at least 1 year because of the program. The state picks up the program and says, we can implement this for a much larger proportion of girls in the state of Maharashtra, and we're now affecting 60 million people instead of 600 girls. That's a measure of success.
ICRW does a large range of work on the issue of HIV and AIDS. We focus on the issue of HIV stigma. You got HIV because you were a bad person, because of your immoral behavior, for example. Women who live at the poverty line are incredibly dependent on their local networks. They're dependent on their neighbors when their child gets sick. The minute gossip starts in a network like that, your support system breaks down. We took that research and developed action out of it. We developed a toolkit, a set of participatory exercises, and those are being used now across the globe. It's being used with children, it's being used with healthcare workers, it's being used with faith-based organizations, it's being used with the Communist Party in Vietnam. This work started with research, with insight, with learning how do you actually tackle stigma. And that action is happening and it's having an impact. So it's the full spectrum of insight to action. I think it's very clearly is a picture of what ICRW is about.
In India with CARE, we were working on reproductive health programming. CARE was delivering a range of services that reached from maternal health, sex education, gender-based violence. And what CARE was experiencing was that their field workers, who are well-trained professionals, knew all about best practice. But because they themselves were embarrassed by the issue of sex or sexual relations or discussing reproductive organs, probably weren't able to communicate as effectively as they could with community members. So what we did with our research and our technical support to CARE was to help the CARE field staff begin to unpack that baggage, where we used all different kinds of methodologies, experiential workshops, provocative discussions, basically creating a safe space. And what we have at the end of a 2-year process is people who feel greater confidence about their understanding of these concepts, interventions that are much more attuned to the way people live their lives. It's the enormous satisfaction of knowing that you've had a small part to play in a much larger puzzle, and that, it does make a difference in someone's life. I think that that's what it's all about.
That is the kind of world that we want to create, a world in which women and men can equally enjoy the rewards of productive labor, where women can be free of violence, when women can have voice without fear, where women can participate fully and benefit fully from the contributions that they make to their societies. That's what we seek, that's what we're about, and that's why we undertake the work we do.